I'm Dr. David Beaulieu, and I'm here with more news you can use. I want to talk to you today about a very, very important vitamin that is incredibly related to brain damage. I spend a lot of time in this area. None of us want to lose our mental capacity as we get older. And all the help we can get is important. Did you know that 1 in 8 Americans over the age of 65 and nearly half of all individuals over the age of 80 suffer from severe cognitive decline? Wow, that's a lot. Unfortunately, many of us are familiar with the hallmark signs of brain aging: declining mental energy, brain fog, senior moments, irritability, mood swings. These are not normal signs. This isn't supposed to happen. Vitamin B12 deficiency affects nearly 50% of older adults. We see low energy and weakness, confusion or fuzziness, persistent sleep problems, digestive problems, hearing and vision loss, memory problems, irritability, mood swings, dizziness or lightheadedness, weak immunity, tingling in the extremities. There was an interesting article many years ago. I went back to see if I could find it and was unable to do so. But it was printed in the New England Journal of Medicine, not as a research article, but just as a letter to the editor, where a number of psychiatrists at the Massachusetts General Hospital affiliated home were working with people, all of whom were over 75 years old, none of whom were allowed outside of the residence. They were all mentally infirm to the point of internment. And so they were interned there in this facility. And they did the necessary testing to see if these people had pernicious anemia, which is a clinical sign of vitamin B12 deficiency. And none of them did. They gave them all fairly large doses of vitamin B12. They did it injectably. What they found was the vast majority of these people became sharper, they became more involved. Something like half of them began driving again and leaving the facility on a regular basis. They began taking on the persona that would have been considered normal for someone 15 years younger. And I was astonished by it. Emerging research is showing that one of B12's most powerful protective properties for the brain is its ability to lower levels of the stress marker homocysteine. Well, this is really, really important for cardiovascular disease as well. There's a link here to indigestion, because in order to utilize vitamin B12, you've got to have intrinsic factor. The stomach's got to be working properly. You've got to be producing hydrochloric acid. Your upper digestive, phase 1 digestion has to be right. If you're over 45 or 50 years old and you're starting to have symptoms of indigestion, you are at extreme risk for B12 subclinical deficiency. And what the doctors in this study at Mass General said was that the primary subclinical signs of subclinical deficiency was aging. My goodness gracious, that's incredible. The symptoms of aging are the symptoms of subclinical vitamin B12 deficiency. That's absolutely huge. Now, I know a fellow in my practice who came in. He'd been a vegetarian for a number of years. I had him try some vitamin B12, had to talk him into it because it was an animal source. Inside of a week, all of his symptoms had gone away, and this guy was in a state of major brain fog. Vegetarians have a hard time getting enough vitamin B12. It's really, really important. You've got to have enough intrinsic factor and hydrochloric acid. If you're on any product that reduces hydrochloric acid production, you're asking for subclinical B12 deficiency. The shots contain aluminum. Do we want to give B12 for better brain function and then put aluminum to preserve as a preservative in the shot when we know aluminum accumulates in the substantia nigra, neurofibrillary tangles, and contributes to dementia, Alzheimer's dementia? That doesn't make any sense at all. To take B12 and swallow it, if your stomach isn't producing adequate intrinsic factor, it's not going to help you. You need to take a sublingual B12. A B12 you put under your tongue. We sell a lot of sublingual B12. Needs to be a good high quality, and it does. People see remarkable results, especially people over 50 years old and people who've been on some kind of a hydrogen blocker, some kind of a controlling medication for indigestion. B12 is extremely important. You've got to be very, very careful that you don't get into a subclinical deficiency pattern again. What these psychiatrists noticed up in Boston was the signs and symptoms of subclinical B12 deficiency are identical to the signs and symptoms of aging. Are you aging too quickly? Maybe a clinical trial of some subclinical B12 could be in order. Think about that.